Keaveney, and you also have 10 minutes.
Thank you,
Deputy.
Catherine. I'd like to thank Deputy Troy for having the commitment to bring forward this private member's motion. Early childhood care in cost and in quality is one of the key concerns for both working families and indeed for families that rely on welfare. The provision of childcare is currently interdependent with employment and the improvements of financial supports that are available from the welfare system. And I would argue here tonight that it is critically important that we look at the incentive for working families to remain at work or to return to work from unemployment. We know that studies have shown that investment into childcare results in the reduction of poverty and increases the educational opportunities for children as they progress through their lives. Given that still the predominant role played by women in Irish society, I would also argue that it's in the current system is an inhibitor for women to fully participate in the workforce. And it is causing arguably a significant inequality in our society and certainly in our economy in terms of the outcomes and effects of not having a policy that's geared towards families in this respect. Government action is needed to address the cost of childcare for working families, including those seeking employment, and that means that we need the intelligent distribution of supports to help us tackle with the significant cases of various welfare traps that currently exist. I would argue that alongside with the need to reduce the cost of childcare, there's also a need to improve the regulation, as has been set out by the previous speakers, and that those working in the sector would indeed have an opportunity through that regulation to integrate with the core values of informing with comprehensive policies in this area. Minister, I hope you would accept that targeted supports through tax breaks or indeed adjustments in the family income supplement or direct payments to families that are on the border of family income supplements could indeed deliver a more cost-effective childcare for those on the margins that has been said already by previous speakers. Now, I think if it's done correctly, we would also encourage the providers of the service currently who are unregulated into a regulated tax compliant sector. These measures would place cost on the public purse, that is for sure it would at the outset. But I think over the course of time we would see revenues generated for the exchequer in compliance, increased employment and increased participation in the labour force. Now, as we develop a fully integrated system of childhood education and care, I would argue strongly that the inclusion of children with special education needs within the system is critically important. Our party supports a policy of inclusion that every child with a disability or a special educational need is enabled to access early childhood education provision and is integrated into an inclusive system rather than the notion that a child would be put into a specialised setting. And that is unless the child, of course, has needs that would require a specialised setting. The benefit of such integration and inclusion are manifold. For a child with a disability or a special education need, they grow up, they are included in the same social life as their peers and are not, I quote, hidden away, as used to be the practice. These children and the adults that they will later become are entitled to play a full and wholesome part in society, and I think that this motion should consider tonight how we can best assist to provide for children with disability in the future. For other children, benefits are to socialise and start a life seeing those with a disability in mainstream life and special education needs as being a full member of society. I've seen this with my own children, where their friends in school include children with Down syndrome. Without any reflection, idea, or question or analysis, they regard their colleagues as full and wholesome members of society. I think it's far healthier, I think it's a great attitude, and I think the notion that we would exclude children with disabilities is one of the old school. Much progress has been made in the area, but much remains to be done. As with our schools and so with our childhood settings, we can't allow a small number of childcare providers share a burden that essentially requires them to be the serious providers in this area, whether it's on the ground of income, ethnicity, member of a travelling community, disability as I raised, special education needs or early service providers. They need to work towards a total inclusion strategy. And the current community childcare subvention scheme unfortunately reinforces, I would argue, the segregation of children from low-income families into the childcare setting. The only serves to undermine what I would argue is the principles of social inclusion and ultimately social cohesion. In relation to the inclusion of children with special needs, I think we should look at integrating the supports that are currently there at a discretionary level from the HSE. And that are available at a varying level or degree across the country. The pattern regionally, in terms of the variety or levels of support or provisions for children with special needs, was only too evident last week when we seen the outcome of the lack of, the real investment into early intervention teams where children have disabilities. We cannot, as a society, tolerate where families in this situation face a lottery with respect to the availability of supports. The right to a child would have in Cork or Galway or Dublin is no less than a child in any other society where they have a right to be fully inclusive in context of their public services. Any proposal or recommendation developed would enable, of course, the inclusion and the full implementation of the ESPAN Act 2004 and the development of an inclusion policy for early childhood sector, responsibility for the provision of special needs assistance to mainstream preschool services must rest with the HSE in the context of their disability support services. But the expansion of a flexible model in the early childhood provision is recommended, and we would very strongly support any initiative that the Minister would have in this area. It would enable for a system of dual placement with specialist or mainstream provision, and we could see the enhancement of an integrated model of professional supports and services for the individual learning and support needs of a child. So in line with reducing the challenges faced by children, I would also argue that the extension of the free preschool year, which has been addressed by some of the earlier speakers, has been an enormous benefit for families in society. And I would say that we should accelerate the rollout of the second preschool year for children. It's important that the extension of the second preschool year be done on the basis of needs first, and then, of course, expanded on a resource basis to allow for families and children to fully participate. And, of course, the development of childhood services where early money pays dividends, it pays dividends for the future, and it prevents the cost of postponing greater cost to the exchequer by not investing early in the educational outcomes of the child at an early and at a primary stage. Finally, in relation to care of children, it's essential that we move towards a shared system of parental leave, and that would be equal to the European norm, where we would have we are, as a country, one of the few countries that does not provide for fathers to have some form of leave outside of emergency leave or force majeure, to have leave on the birth of their child or on an adoption outside of a collective bargained arrangement. And I think we need to bring forward legislation that will take effect, like the parental bill that currently, the 2013 bill, which has passed second stage in the Senate. The bill provides for a pregnant employee or a father of the pregnant employee's child that they would be permitted to take paternity leave at the same time, and that they should be permitted to share between them a minimum period of maternity leave. So therefore I call on the government to facilitate the passage of that legislation. I think it's a worthy measure. I think it would help tackle the latent sexism that exists in the economy, in companies, and that is it would provide for greater flexibility for families making, arrangements around their childhood and the childhood arrangements of their children. Can I conclude, Keaveney, by saying the motion, it's an issue of concern for families. It's multiple economic, it has an economic benefit, it has an educational benefit, but it's an entirely positive motion, lacking in any political attack. It's a motive I concur with, and encourage the government deputies in light of that to positively consider supporting it. Thank you, Keaveney.